thanks for allowing me to trying to point towards some ideas of systematizing the study of altered states of consciousness that have evolved over the last years. Therefore, I was calling this systematic study of altered states of consciousness, and want to point in this presentation towards some what is standards in the field with regards to the assessment of the phenomenology across different altered states, what tools are there, and where to go from where we are at the moment, and where there's agreements and discourse or disagreements about what we talk about when we talk about an altered state of consciousness. And this is where it starts when talking about an altered state of consciousness. I think here the organizers did it in a very elegant way to bring in the term altered states and the term non-ordinary states. Actually, if you go through the literature, this is not the only terms that one can find. One can find also terms like modified states or patterns of phenomenological properties, exceptional states, modulated states of consciousness, expanded states, higher states. Now I learned also pivotal states. I need to add to the list, where in some authors might say, well, it's all different. I think overall the core is the same that people are referring to here, where in current writing, most authors trying to choose a pretty normatively neutral formulation, something like altered or non-normative. So one is not saying anymore higher states of consciousness, as it implies that, these psychedelics are above and beyond the normal state, and therefore have some specifically higher normative character. But all of this terminology is around, so I believe for a field it's good to explore at some point terminology, but then also settle on some wordings that one's using. It's quite funny about the discussion if it's non-ordinary states or altered states. On the ESISy conference, Chris Timmerman and I had a bit of a discussion about it and used a big WhatsApp group to ask all the people in the field that they should vote for altered states or for non-ordinary states. And I'm happy to say that altered states was winning the vote. People prefer the term, as it was quite worrying for me as I'm running the altered states database, and I didn't want to rename it into non-ordinary states of consciousness database, even so Chris suggested he will buy me the domain if we have to rename it. But so when talking about these states, what in general is one talking about? We did the effort and we're going through the literature looking for different types of definitions and seeing what defining criteria people suggest to talk about altered states. So one defining criteria is most often used is that for the person who is experiencing the altered states, there is an experience. So it is defined by the subjective experience. It's not necessarily that from the outside you're ascribing to someone you are now in an altered state, but it should be noticeable. There's some edge cases, something like mania, where people might say, okay, this person is having a manic episode and is in an altered state, but the person is saying no, it's not the case. Typical definition would be that from a first-person perspective, it should be accessible that you're in an altered state. Another thing is then, what does altered mean? You need to define somehow ordinary or normal as a reference state to define what altered actually means. Quite problematic, quite difficult. A suggestion here found in the literature is to say that everyone is having a good intuition what your fluctuations in your everyday experiences are, and if it diverges significantly from the normal fluctuations that you have, then let's call it an altered state. So that's maybe the most pragmatic way of defining it. Then there is the point that it should be transient or reversible, which is distinguishing altered states of consciousness from psychopathologic situations, typically. But this is just a defining, playing with the words. You can also define, of course, like a psychopathologic state, but this is how it's most typically used. Final defining criteria that people say, it should to talk about an altered state of consciousness, it should not only be a change in one cognitive domain. So it should not be just more or less arousal. You would maybe not call it an altered state, but it should affect multiple aspects or multiple features of consciousness. And there comes the next important and interesting bit, and this is what I feel one can focus on in the question to systematize altered states of consciousness research. And this is actually the question, what are these defining characteristic phenomenal features of altered states? So what is the different aspects of an altered state? And when I use these words, also here in the literature, you can find very different terminology, how people refer to those. Some people call them dimensions, some call them properties or aspects, facets, characteristics, structures, subsystems, features, or domains. Also here, I believe in the end, people speak about the same thing, just don't agree on the terminology. So maybe at some point we can agree. I guess most common, also based on the questionnaires which are there, the 5D ASC, is that people use the term dimensions. I think also like here in this meeting, most people use the term dimensions. And also using the term dimensions goes along very well with what we saw in the very first presentation by Chris Timmermann, who displayed, in just a bit of a different way of displaying it, something like a formalization of a consciousness state space. And this idea is, or the idea here is that one can represent the current state of a person as a dot in a high dimensional space, here visualized just with 3 dimensions, and then you're having during your normal day, during your normal average consciousness, also over a normal day, a normal trajectory. Sometimes you're more aroused, less aroused. Let's assume one of the dimensions would be arousal, so you're like on this axis having some fluctuations. And then like over time, one could define such a subspace here, which would be like your normal everyday subspace. So like a space where you are having your typical experiences. And then if we have a good definitions of what these different dimensions are, one can also define what would be a psychedelic state by having these characteristics figured out. And then give specific types. Where an example is like, what is a psychedelic state is quite hard to define in the end, because some people say it's like all the states that are induced by psychedelics. And then you ask, what is a psychedelic? Well, it's those substances which are inducing psychedelic experiences. Circular definition. So one needs to define what is actually the phenomenal features which are affected. When looking at the quantitative literature, most of you will have seen these graphs here, a famous review article by Franz Vollenweider, with giving the comparison between psilocybin and ketamine experiences with standardized questionnaire tools. And using standardized questionnaire tools, which are then having, like in this case, with the 11 ASC questionnaire, suggesting something like an 11-dimensional space in which you can classify a particular experience. Yeah? So this would be how this relates to the state space approach. And this is something to somehow here make states comparable with each other and to collect the data, an effort that we were following now, I don't remember exactly, maybe 7-8 years, with a project that is called the Altered States Database, where we try to provide for research comparison data. And this is all comparison data which is in the literature. So we are doing every year systematic literature research and are extracting all available questionnaire data and putting it into a database which you can use in order to make your data comparable to what is in the literature. We have 2 papers published on this, just methodological reports, and the website which is running is used by quite some people per day. So I believe this is only researchers who is interested in the comparison data, plus maybe some people who are basically interested in what type of effects can you expect from what type of drug. All data is collected according to common standards in the field of meta-analysis, PRISMA standards, standard PRISMA flowchart. And we're updating it every year. So what you can find is our website, asdb.info. And the website on the front page asks you, what is it like to be on? And then you can select from different induction methods. So you can ask, what is it like to be on LSD? What is it like to be on psilocybin? What is it like to be on meditation or on strobe light? And you will then be displayed with all of the data that is available in the literature with such like nice visualizations in R-Shiny. You have here the references to the original publications. And actually, if you click on data table, you will also see the exact values as they were extracted from the literature. You can use dosage ranges, sample sizes, the year range. You can play around with the data and can interact with the data and thereby get a good overview what type of effects are to be expected with what type of induction method. And thereby, it also encourages you as researchers to use the standardized questionnaires tool to make your data particularly valuable as you make them comparable to the literature. So thereby, it is encouraged to also use the questionnaires which are described there. There's maybe one thing I want to point to. One doesn't see it here so well, but if you land on the page and if you go here to the menu, in the background there is a whole, I would call it a book in the meantime, where all of the questionnaire tools are described and discussed, and where you get them from and how you use them, which translations, which validations are available in the context of altered states research. Just like as a researcher's resource, if you are wondering what type of questionnaires you should use or you want to use these resources, and you're also welcome to write us an email if you have questions, and we try to support you with that. What one can do with this, ultimately, we have now 2 papers out where we were doing dose response estimates. So you can then basically for psilocybin and for LSD have here different dosages. You can fit a model, you can fit a linear model or a sigmoid model or any kind of other model to model what effects to be expected with this dosage, and can compare different substances. We even have an app online where you can here check for dose response relationships of LSD, and then you can here say with what dosage that you are choosing, what type of effects will be expected based on a full meta-analysis, and then on different types of questionnaires. You can see here, then this is how it looks like that you're having a sigmoid model fit into the data. And so this data and this meta-analysis is, I would say, at the moment also the best standard. If you want to refer to something, why in a clinical trial, you use the specific dosage to argue what type of effects you're expecting. So we encourage this and encourage to use it, to reference it, and then you can argue why your dosages are reasonable. And as said, this is updated every year. We are then always publishing a preprint with the latest extraction of the data. At the moment, this is the amount of data sets which are in from more than 200 articles, and this here is such a list similar to the list I showed earlier on the slides with all of the different pharmacological methods and the non-pharmacological ones, and this is the ones for which data is available. At the same time, this list should create the demand that there's many other methods for which simply no data is available yet, and you cannot compare it to the existing data, that one is also using the standardized questionnaire tools here. Best part of it, everything is an open science, open data project. On the open science framework, you will find Excel sheets where you can take all of this data, which was by very intense handwork taken out from the literature. If you extract this data, how does it work? You have a bar plot, and you go there with a ruler and measure the size of the bar plot and the size of the standard deviation, normalize it, because so many people don't give their real data. So if you publish also, then please give some data tables so that we don't have to sit there and measure. Still, all this effort is done, and is done every year. I'm always having a bachelor thesis running every year to make the update, and we will keep this going. So this is a data-driven side for where are we with the data to make the study of altered states systematic, and what questionnaires are there to measure such dimensions of altered states. However, this is just the data that is there. One can have also more conceptual ideas about it, and can also for good reasons criticize that these questionnaires might not cover everything. We were earlier discussing diversity of hallucinations not well covered. So, because this is a common criticism to all of these data-driven approaches with the questionnaires, and it happened to me quite often that people were saying yeah, but Timo, people had already a better conception of this in the 70s, and you just like don't know the literature. So I was like now extremely happy to work together with Larry Ford, and this is a project and an article that Mark Wittmann was already referring to, where we were going through all of the literature looking for what type of classification systems did authors suggest in the literature, in the history of altered states research, for along which dimensions or which features can one classify or characterize different altered states. And we try to summarize this. It's now quite an, I would say, educational article. Always like one section for every of these classification systems, and then like explains the background of it and what dimensions are proposed. Maybe just like one example here of one where Mark was like part of suggesting it, where like time would be one dimension, effect would be one dimension, and awareness would be one dimension. So here a three-dimensional case. Many of those schemes are not just three-dimensional, they are 10, 12, 20-dimensional. So what we did in this article is like discussing all of those and in the end extracting all of those features or dimensions and trying to see what do they have in common. So like a meta analysis of already some meta conception of altered states. And that's the result here. And that's something one can discuss if it's useful to build up on. We just like clustered the terms for these different dimensions that different authors are suggesting and see where they agree. So we see like many authors are talking about some kind of hallucinations or imagery. There's body image, highly relevant, self-boundaries, significance or mystical or meaning, major cluster, arousal, quite obvious, time sense, and then these two clusters, which are rather collective umbrella clusters for all types of emotions, all types of cognitive control or processes, where one could do much more finer identification of different aspects that altered states experience might have. And so this might be something for the future as a working plan, how to operationalize these appropriately, how to get questionnaire tools out so that one can, with maybe an even better classification scheme, then quantify what type of states one was in and improving the questionnaire tools which are currently there. Why this is important, not only for basic research of identifying what are features of altered states, but in an article which goes very much in the same direction by David Yaden, he was also like looking at all of these questionnaire tools which are out there and was then basically doing the exact same thing of asking what type of dimensions do they have and how do they cluster together. Just overall framed a bit more in the context of psychedelic therapy by saying like, well, in the end, what we are looking for is what are predictors for therapeutic outcome and what is those aspects of an altered state experience that we want to promote, that people should have more about, so that then they benefit most. And in order to do this, one needs to have a good conceptualization, one has to have a good operationalization, and then one needs the data in order to argue for it. So this is somehow where this basic research, and maybe this, like for the neuroscientist, it's far away to do phenomenology and reading these gloomy words like oceanic boundlessness. What does it even mean? And then like there's test theory with which you can do good questionnaires, you can validate them, you can see that you're measuring across multiple people the same thing. And then you have it available at some point as a validated questionnaire for your research. And then for the practical research, or for the applied research, one can then use those as potential predictors for therapeutic outcome. And this is why overall I want to say that it's very important to systematize the research a little bit, to look through these different fields of the research, to use also standardized tools to make your data reusable by the whole community and to accumulate data overall. And that was the small impulse that I wanted to give for the start of this discussion, so that like my vision for like what is important for the systematic study is that we step a bit back and go to study phenomenology again and standardize it and then get there to have good classification systems. Thanks.